Hello, and thanks for joining me for my weekly video message. This week, our nation reported the single-day record for COVID cases of 1.5 million cases. And experts are saying we're probably only diagnosing somewhere between 10 and 20% of the actual infections, since a lot of people are not testing and are walking around with mild symptoms, unknowingly spreading the virus. In Montgomery County, we continue to see our test positivity rate hovering about 25%. While we continue to be lower than the state's positivity rate, our positivity rate is currently almost as high as it was during the first month of the pandemic in 2020. And our case rate, 283 per 100,000, is higher than the state case rate due to our high testing volume, and is 5 times higher than at any other time during the pandemic, and is 70 times higher than it was when we thought this was over last summer, when we dropped around 4 or 5 cases per 100,000. Our top concerns and focus continue to be our hospitals and our schools. Statewide, there are nearly 3,500 Marylanders who are hospitalized with COVID, a number that has doubled over the last 2 weeks, and 1,500 more people than the previous height of the pandemic last winter. 84% of patients in the hospital with the virus have not received the full series of shots. In Montgomery County, we have 560 COVID patients who are hospitalized, which is the most we've had since the beginning of the pandemic, and our deaths so far this month are 26, and we're not even halfway through January. I heard Councilmember Rice share a disturbing story about his mother having to go to Holy Cross Germantown Hospital with a heart attack after Shady Grove was too full to accept her, and she then had to be transferred to Adventist. This ordeal for Mrs. Rice and her family highlights the need for people to get vaccinated, because the vast majority of those in the hospital with COVID are the result of being unvaccinated. And these unvaccinated people who are catching COVID, getting seriously ill, are then taking up bed space that is greatly needed by others. We're thankful that Mrs. Rice survived this healthcare scare, and we wish her a speedy recovery. I do hope that Councilmember Rice and his family sharing this experience inspires others to get vaccinated. It's another wake-up call to the unvaccinated about the risk they are taking with other people's lives by refusing to get vaccinated. I want to take a moment to acknowledge that dealing with this surge and the impact on our schools is very tough on everyone. We're in a difficult place. The good news is we delivered 190,000 rapid tests to the schools. This should help families be more aware of the child's health status as we are able to assist MCPS knowing the status of their teachers and staff. I'm very concerned about where we are with our schools. This is a no-win situation. I know that schools are trying to balance learning loss and other problems that come with virtual learning, and versus how to slow the spread of the virus and address the number of staff who are out sick. And I've been looking at email correspondence that I've been receiving, and it seems to me basically about 50-50, depending on the day of the week. It's split between parents who need and want schools to be open and are concerned about continued learning loss from virtual learning, and the other half are folks who think that opening the schools is unsafe and is putting their children needlessly at risk, and from staff members who are concerned about the ability to maintain a safe environment in school. The one consistent frustration I'm hearing from parents is that they need better communication from MCPS to not only understand what the decisions are, but why they are being made. The staff challenges affecting the schools have also been very difficult, and this is impacting more than just teachers, but also the school bus drivers, paraeducators, and building school service staff. These shortages provide real challenges for in-school instruction. This week, at the request of MCPS, we reached out to MEMA to request any state support or resources, including the Maryland National Guard, who would qualify to drive school buses for us. Unfortunately, no resources are available, but we continue to look for help and assistance from MCPS. But whether it is a substitute teacher or a school bus driver, nurses or social workers, these professions are hard to find replacements for. Just picking them off the street is not going to happen. I have and will continue to support and assist MCPS and Dr. McKnight and the Board of Education with any help we can provide. Our record high rates of community transmission are also not only impacting the community, but they're impacting staffing levels, not just in our schools, but in the county operations itself. 2 weeks ago, we announced staffing changes and service reductions in our fire department. This week, our ABS stores had their hours reduced, and ride-on routes are being limited due to staffing shortages. We apologize for any inconvenience, and we encourage residents to continue checking out the county website and following our social media pages for consistent updates. I do want to thank and acknowledge that despite our staffing shortages, our MC.DOT snow removal crews and contractors did a great job last week with significant snow and ice events that occurred. This was our most significant snowfall in quite a while, and we heard very few complaints about the plowing. We're attacking this current COVID surge with testing, vaccinating, and boosting, as well as mitigating community spread. We've ordered 2.1 million rapid take-home test kits thus far, and 588,000 have already been delivered, received, and are being distributed. This week, we began to distribute free rapid take-home test kits at county libraries. We gave out 125,000 tests in just our first 2 days of distributing these kits, and we've been running out daily from the supply that's been allocated. Please note, we will begin distribution at times on the website. However, supplies go out quickly, and we'll continue distribution on subsequent days as posted on our website. When we start distributing at 4 p.m., for example, supplies are not usually lasting longer than the first hour, and certainly are gone by the second one most of the time. Additionally, we're also working with both Poolsville community and with the Tacoma Park Library to include them in making sure these communities are going to be able to take part in this distribution effort. Rapid test distribution. This is a very big operation with a lot of logistics. I want to thank our entire team, including the library and other employees who are on the front lines helping us distribute, and also thank our Medical Reserve Corps volunteers who are also helping us at the distribution sites. Our emergency management and procurement teams have done a great job to move shipments that come in, get them out to residents as quickly as possible. And I'm grateful to the residents who understand how important these tests are and have come out, waited in cold weather, and have generally been patient and understanding of this process. I do ask all residents to avoid hoarding these tests for themselves. We will continue to provide supplies as we can make them available, but we need folks to understand that every resident and every family deserves access to these tests. And if people hoard them, they're going to limit our ability to get a true picture of the spread of COVID in the community. We're asking residents to upload their results onto a new web portal on our website so that we can better track the total number of cases. For us to reduce this current surge, we must be able to test and isolate when test results come back positive. This week, we launched a web portal that will allow residents to notify HHS if they do test positive. Residents who test themselves with a rapid at-home COVID-19 test can now report their results on a self-reporting portal that can be found on the COVID-19 testing section of our website. The more self-reporting we receive, the more accurate we can be in evaluating the amount of COVID that we're seeing in the community. Following my positive test results and isolating from COVID since January 1st, I'm glad to report that I'm feeling much better. However, I tested positive again today, so that would be 12 days in a row. One thing that I noted while being sick was that my blood sugar spiked and has stayed high. And as a diabetic, this can be very dangerous. When I noticed my numbers, I did some research and learned immediately what I needed to do. And I spoke to my doctor and found lots of reports about the health impact of this virus. It's an example of the actual reasons of how COVID can produce more problematic health outcomes. It's the higher sugar level that actually does some of the damage to your body. So if you're diabetic and if you're monitoring your sugar, which we're all supposed to do, then if you see your sugar levels start to spike, consult your doctor. My doctor had suggestions for what I could do, and they were helpful, and this could be helpful to you. I realize that we often have talked about comorbidities and how those with pre-existing conditions may be more susceptible to COVID-related problems. But we generally don't give details of those, as well as the long-term impacts for those who've caught COVID and what they may be dealing with. So if you do test positive for COVID and are, like me, having a pre-existing condition, Please take the extra step and make sure you are closely monitoring any symptoms you might have as a result. It's important to keep track of how your body is responding to COVID, not just a cough or a cold or a sniffle, but there are other things that can be going on. This week is the beginning of the Maryland General Assembly's 2022 legislative session. This year, there will be a lot of continued focus on the state's COVID-19 response, recovery, and specifically the impact of this pandemic on schools and children. Redistricting, legalizing marijuana, voting rights, and climate change are also on this session's agenda. I encourage everyone to please refer to our legislative priorities for 2022, and we will continue to update you on our progress with the bills that we want to get passed and projects we hope to see funded. I want to wish all the county, state, and House delegates a productive session. I look forward to working with them over the next 90 days. Next Monday, we will honor Dr. Martin Luther King Day holiday and National Day of Service. Usually every January for more than a decade, the Montgomery County Volunteer Center has brought thousands of area residents together for an afternoon full of volunteer activities featured at its large-scale Dr. Martin Luther King Jr. MLK Day of Service event. However, due to COVID this year, similar to last year, the event has gone largely virtual and it's been expanded to a week with a variety of home-based and safely distanced service opportunities available online. The Volunteer Center's 2022 MLK service event runs January 15th through the 22nd and offers residents of all ages the opportunity to honor Dr. King's life and the teachings of Dr. Martin Luther King by participating in remote service projects that help others in our community. All events and activities are free, but registration is required and space is limited for some of these projects. As we honor Dr. King by serving our community, we should also recommit ourselves to the founding principle and pillar of the civil rights movement, and that is the right to vote. Since last January 6th, there have been over 200 laws passed throughout the nation with the intent to suppress and obstruct voting rights, and I was pleased that President Biden endorsed changing the Senate rules this week to pass new federal voting rights legislation that will help protect our democracy. As President Biden asked during his speech, do you want to be on the side of Dr. King or George Wallace? Do you want to be on the side of John Lewis or Bull Connor? Do you want to be on the side of Abraham Lincoln or Jefferson Davis? These are important questions every American should be asking as we think about and honor Dr. Martin Luther King this weekend. It does matter which side you're on. This week, I joined Council President Albornoz in proclaiming January as Human Trafficking Awareness Month in Montgomery County. Slavery and human trafficking is often considered an historical problem, but there are many people trapped in modern-day slavery today, and this continues as well as human trafficking. This is a global problem. It is estimated that 20.9 million people are trafficked worldwide, and 24.9 million people are victims of forced labor. 16 million people are trafficked for forced labor in private economy, 4.8 million people are trafficked for forced sexual exploitation, and 4.1 million people are trafficked for forced labor in state-imposed forced labor. Women and girls are disproportionately affected by human trafficking, accounting for 71% of all victims. Human Trafficking Prevention Month is a time for us to educate ourselves and our friends, family, and colleagues to ensure that more people are aware of the issues around human trafficking and more aware of signs of human trafficking when you may encounter people in our neighborhoods. Because awareness is a key for prevention, we hope you'll take some time and learn more about human trafficking. Since 2014, Montgomery County's had a human trafficking task force that transitioned into the Montgomery County Human Trafficking Prevention Committee. This committee meets the third Wednesday of every month, and I encourage your awareness, engagement, and participation in our efforts to combat human trafficking in Montgomery County. Thanks for listening, and I hope you have a great week.